Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here.
Hi, Amanda. Good morning.
Good morning, Maddie. How are you doing?
I'm doing well. Today, we are jumping into an episode that's all about our initial women's health evaluation, our first women's health appointment. And let's see, what does it look like? What are some of the labs that we test for kind of right off the bat? And we're going to take you guys through what that process looks like.
Yes. And often women come to us and they've had labs at another provider and they're told that everything looks fine, everything's within standard range, but they don't feel well. And it's not that these other providers are wrong when they say everything is in standard range, but the truth is that standard range is not functionally optimal range. And so when we look at labs at Fiat, we're going to be looking at what range is best for you to feel your best, for you to have normal cycles, and for fertility to be optimized, because that's a sign of health.
Absolutely. And our focus, is really restorative reproductive medicine. So that means looking at your menstrual cycles as really that vital sign of health, just like your blood pressure and your heart rate. And so our hormones are messengers, and they tell us a lot about your body, and they tell us what's happening beneath the surface. And so we want to look at, your female, your male sex hormones, your, hormones that have to do with metabolism, and to see what that tells us about your health in a really in-depth way.
And so why do we evaluate differently? So in traditional care, a lot of the goal is to rule out disease. And that is important, but a lot of women don't have a diagnosable condition, but they're not feeling well. They are having infertility, miscarriage, PMS, hormonal disruptions in the perimenopause phase, whatever it is that tell them that things are not normal. And like you said, the menstrual cycle is a vital sign. And so our first stop is to look at that and say, are you having 28-day cycles? Are cycles irregular? What does the bleeding pattern look like? Is it heavy? Is there mid-cycle spotting? Is there brown bleeding? Are there things that we can pick up on that can guide us in what labs to order and what direction to go with care?
Absolutely. So then that kind of brings us to our first appointment. What does that look like? So our initial visit is typically close to an hour, depending on, the individual's history. We're sitting down, getting to know each of you, if you're a patient or a prospective patient, about your history, not only just your menstrual history, though, of course, we definitely dive into cycle length, your ovulation patterns. Are you tracking your ovulation? If so, how? If not, let's talk about it, because that's definitely an important part of tracking and being aware of your health. Are you having premenstrual symptoms? Have you ever been pregnant? What is that pregnancy history? So, and that is in depth in itself. So, full term, preterm, problems with pregnancy or delivery, gestational diabetes. How was your postpartum period? Did that go well? Was there a lot of, did you have any postpartum depression or anxiety? And then, of course, social history. So learning about the person on the other side of the table, as far as any other, surgeries or emotional stress. How are you sleeping? All those different things that impact health. So that typically is a pretty extensive appointment, especially compared to what a lot of patients have been used to in other practices. So like I said, 45 minutes or an hour, depending. What else do we talk about, Amanda?
So we often do ask about stress and sleep. Those are two very important things. And sometimes insomnia can be a clue into a hormonal imbalance, of course, or something like an endorphin deficiency. And really, the quality of sleep and how you're sleeping is important as well. Are you sleeping in total darkness? Because that does matter when it comes to hormone balance. Energy levels are asked about. That's one of the most common things women complain of is I don't have good energy. And almost 100% of the time, we can find something on labs or evaluation that tell us why that is.
Mm-hmm.
Also can sometimes be caused by an endorphin deficiency. Digestive issues, of course, the gut is very, very important. And so digestive issues often give us a clue as to how healthy the gut is, but also how balanced the hormones can be because many hormonal abnormalities come with digestive symptoms. We do take a full thyroid history, and that includes family history of thyroid disease. Thyroid disease can impact many things, and lab values that are in the normal range often miss underlying thyroid problems that can be contributing to a whole host of female health conditions. Sometimes even when it comes to delayed ovulation or ovulation defects, with good thyroid treatment, you can see those correct very quickly. Family history of autoimmune patterns or personal history of autoimmune patterns. A lot of women come to us with an elevated ANA, which is a marker of autoimmunity, but no real reason why. And most of the time, that also is contributing and is a clue to us that there's underlying inflammation present.
Definitely. And a reason that, getting to know our patients and taking this in-depth history and asking these questions are really important is because it not only informs the labs that we're going to, of course, draw, but labs in isolation only tell us so much. Like, in addition to the symptoms that you're experiencing every day, like that really is what gives us the full picture, enables us to treat the person as a whole person, and really, really teaches us a lot. It teaches us, what questions to ask, where to look deeper. Obviously, that is very important to us and important to discovering, your health condition as a whole. Another thing that I wanted to mention was, getting back to the cycle history that I was mentioning earlier that we take a look at. Another important element is any history of birth control, because that not only does that impact, your health and health status potentially now, but also in the past. Like, were you recommended oral contraceptive pills at 15 because of really heavy bleeding or, irregular periods, things that tell us elements about your past and your past self and your past health that really help to inform where you are now and your health history, since your prepubertal years, really.
Absolutely. So when it comes to the labs, we don't order labs randomly. Each test answers a question for us. And so a typical lab workup for us includes hormones, vitamin levels, and hormones include a full thyroid panel, prolactin level, vitamin levels like B12, vitamin D, ferritin, and also markers of liver function and kidney function to tell us if we give you treatment, is your body going to be able to use it in the proper way? And we often do labs on multiple days of the cycle so that we can get a very clear clinical picture of what's going on.
Mm-hmm, definitely. So I think now we're gonna chat a little bit about specifically some of the hormones and other lab markers that we are typically looking for right off the bat. So as Amanda, you mentioned, a pretty in-depth thyroid panel. So a lot of women, maybe they've only had their TSH checked, which is one thyroid hormone, an important thyroid hormone, definitely, but really to get the total, landscape of your thyroid health, it's really important to check out a few different markers as well. So your TSH, your free T4, your total and reverse T3, and antibodies are all important in telling us how your thyroid is functioning, which is a part of your endocrine or hormone system. And so it can affect and regulate so many things and so many processes in the body. So getting a pretty in-depth look at, those various markers tell us different things about you.
And we're looking for patterns that we see. So one that's common is a poor conversion of T4, one thyroid hormone, to T3, and subtle dysfunction that may not flag as abnormal on a lab report. The antibodies also tell us, is there an autoimmune thyroid condition going on like Hashimoto's? And often the antibodies are the only abnormal thing we see, abnormal according to the lab ranges. Something that's come up more recently is the importance of that total and reverse T3 ratio to tell us about how well your body is using the thyroid hormones and how much of the thyroid hormone is not being used. And so all of those things help us see clinically what's going on with your thyroid. And thyroid, like you said, affects so many different body processes. And so every women's health problem can be affected by poor thyroid function.
Definitely. And speaking of poor thyroid function, circling back to what we said earlier, where, maybe women have been told that everything looks fine on their lab work with the standard reference lab value ranges, but they don't feel good. So I want to touch on like TSH, for example. So maybe someone's had that tested in the past and their values say 3.5, which if you're looking at, your traditional quote unquote reference range, that can be technically normal, but most women really feel better if their TSH is, in the ones or, somewhere much below 3.5. So seeing a TSH of 3.5, especially given, if someone presented also with symptoms that can be associated with an underactive thyroid, we would offer treatment where a lot of times, in other practices, if you're just using that more traditional reference range, they wouldn't be offered treatment or been even asked further about their thyroid or thyroid function or symptoms associated.
Yes, and thyroid antibodies, something we touched on a little bit before, should ideally be close to zero. There's really not a reason to have elevated thyroid antibodies. And excessively elevated thyroid antibodies, say above a level of about 35, are implicated in miscarriage, and they can also cause a whole host of autoimmune symptoms and thyroid dysfunction when the other numbers look normal.
Let's see. Something else that we check for with some initial labs are like your iron and ferritin values. So these are pretty big, especially when it comes to like energy levels. Yeah, that's a pretty big one that we see. So as far as ranges, you can be, a lot of times when you bring up iron and ferritin, people immediately think of like anemia, but you can actually not be anemic, but have low iron or low ferritin, which ferritin is your body's iron stores, that can be giving you symptoms essentially of anemia as far as fatigue, exhaustion, without actually being anemic, with having a normal blood cell count, for example.
And ferritin is so important, iron status in general, to the function of things like the thyroid as well. And so having it in optimal range can help other processes in your body run optimally. So if ferritin is on the lower end of normal range, like a level of 15 or 20, it's not going to get flagged on a lab report, but it could indicate that things are not optimally functioning. So ideally, we aim for a range above 45.
On the flip side of that, though, it is a little abnormal if ferritin is too high because it's what's called an acute phase reactant. So meaning it can respond to like stress or significant inflammation in the body, which can make it temporarily like quite elevated. And so that's something to look out for as well and repeat if it is significantly elevated. But if ferritin is low or our iron stores aren't really where they should be, that can play a role in anxiety, fatigue, like I mentioned, can even play a role in like hair loss. Heavy periods can lead to low iron stores. So all things that are definitely related and worth investigating.
Right. So we're going to move on to talking about insulin and blood sugar and what we check with those. We do check a complete metabolic panel as part of our testing, which tells us about kidney and liver function, but also gives us a fasting glucose level. But we move beyond kind of your traditional testing of fasting glucose and hemoglobin A1C as the only indicators of how blood sugar is doing. Fasting insulin can be very, very helpful because many women are having women's health issues, especially irregular cycles, sometimes ovarian cysts, because of insulin resistance. But that doesn't show up on a blood glucose monitor because it's insulin, not glucose, that is the issue. And so digging deeper with this helps us know who may have an underlying resistance to insulin while still being able to maintain a normal glucose over time.
Absolutely. And if you know me or if you are a patient of mine, you'll probably know that insulin resistance is something that I'm super passionate about and love to talk about because it really does play. It plays so much into pretty much everything and every disease process because inflammation being the root of chronic illness, pretty much, we know how much insulin resistance affects our health in both the short term and the long term. And so getting a really good handle on insulin resistance is so important for longevity, for, pretty much everything, and for all the processes in the body to happen efficiently, effectively, and to really optimize health in itself. And so that's something that, we're pretty particular about and look for pretty aggressively. We can even beyond our fasting insulin and blood sugar and A1C do further testing like a 2-hour oral glucose tolerance test, which isn't particularly the most fun test, but it definitely gives a lot of, it's worth a lot as far as its value, because not only do we see what your fasting levels look like, but we see how your body responds when it's exposed to glucose. And so, what's your insulin pattern? What's your blood glucose pattern? That's not something we do off the bat with every patient, but it is frequently something that we might dive into if that is a suspicion that we have and we want to see, okay, to what degree might we be insulin resistant and treat accordingly. So that's something that I could talk all day about.
And we like to see fasting insulin ideally under 10. And the glucose tolerance test with insulin levels, we also have parameters for each of those blood draws. So it's usually 5 different blood draws over 2 hours. And we know what your insulin should be at 30 minutes, at 60 minutes, at 90 minutes, at 120 minutes. And so often that is a really helpful test as well, because a lot of women are eating well, but there's more to it when you have a propensity towards insulin resistance and it requires more modifications and more supplements or maybe even prescription.
Exactly. And that's a great point. It's really important to remember and for people to know that insulin resistance can happen if you are, of healthy BMI, if you're active, and it's so much more than how you're eating and how you're moving your body. Now, don't get me wrong, how you are eating, what you're fueling yourself with, and how you're moving your body are absolutely important and foundational. But there's so many other things that can also play in to drive insulin resistance, from, our stress levels to, even toxins that we're exposed in our environment that can cause, stress on the body, which can lead to some insulin resistance. So it's important for patients too to kind of release that, well, this is all my fault if I'm insulin resistant or something like that, because that's really not the case. And there's a lot of opportunity to treat and improve health by being aggressive in taking care of our insulin resistance and helping our metabolism.
And so now we're going to talk about cycle timed hormones and why that's important. So hormones are very time sensitive. For women, especially, a random hormone level doesn't tell us anything. If it's drawn in the beginning of the cycle, progesterone at 0 is normal.
Mm-hmm.
If it's drawn mid-cycle, estrogen sky high is normal.
Mm-hmm.
And luteal phase, you can have any range of progesterone and estrogen depending on what time of luteal phase you draw it. So we are very particular about when our hormones are drawn. We do test our first hormone test of the cycle between cycle day 3 and 5 typically. And this is where we do the majority of our testing. So we will look at the thyroid function, prolactin, female hormones, male hormones. We usually leave progesterone out of this because it is not elevated at that time in the cycle. But it's really important to draw something like a FSH on day 3 to 5 because that is when it tells us something. And a random FSH in the cycle is not going to tell us as much. And then we also do hormones about 6 to 9 days after ovulation. And usually your provider will talk you through how to detect when ovulation is, when your peak day is, in order to get a good idea of what 6 to 9 days after ovulation or after an ovulatory event would look like. And we're typically testing estrogen and progesterone at that time, but we also do a repeat on thyroid and prolactin often just so that we get a pattern throughout the cycle.
Mm-hmm. Absolutely. Amanda, I'm sure that you've seen this too, but we'll have patients who come in and maybe their previous provider has quote unquote checked hormones before, but they're just, if you ask them, well, did they have you go on a specific cycle day? Was, this timed at all? And they'll say no. And it's really unfortunate for the patient because, maybe they did these hormones and they were told, okay, everything's fine, but they weren't even interpreted or meaningful because they were not done at a specific cycle day. So what are you even looking for? What are you even comparing that to? So yes, timing is definitely important for all those reasons that we said. Other things to note about, I guess, timing and timing labs, depending on, what part of the fertility continuum you are on, that can also kind of impact when we're looking at labs, like say the postpartum. There's certain elements in there because hormones are, fluctuating in the postpartum period where we may or may not look at particular hormones because they may or may not be meaningful. So we're taking all of those factors into consideration as well when we're looking at the patient and deciding, hey, when are we getting labs? Similar to, someone who may be perimenopausal or menopausal. All of those things obviously are going to play into when we would recommend getting hormones drawn.
Absolutely. And low progesterone is something we see frequently. This can sometimes be a function of like the postpartum period where the placenta is delivered and the progesterone outflows and that's it until cycles return. But we also see low progesterone in the luteal phase causing things like premenstrual dysphoric disorder, premenstrual syndrome, making it hard to stay pregnant or get pregnant, especially if it's shortening the luteal phase. And overall, the standard range for progesterone in traditional medicine says that a progesterone level of 3 or higher is significant. And we know that people do not get pregnant with a progesterone of 3 or higher. This doesn't necessarily mean that ovulation has occurred. In fact, it probably hasn't if your progesterone is around 3. And so we do have optimal ranges to try to get especially progesterone and estrogen in that post-ovulation phase into normal range. And if it won't come into normal range, that often tells us that there's an ovulation defect, and doing something like an ultrasound to see what is actually going on can be helpful because the hormones can rise and fall, but that doesn't necessarily confirm that ovulation is occurring and occurring normally.
Mm-hmm. And so all of those things that we're talking about, like the ultrasounds and things like that, that will come based on, our treatment care plan once we're interpreting these labs and whatnot. So obviously that's going to be more individualized after our initial appointment. But all of these things are kind of going on in our mind when we're looking at labs and taking into consideration the person in front of us. So other things that we're looking for, we're also looking at, vitamin, nutrient levels. We talked about so far at this point, we've touched on your thyroid, different metabolic and inflammatory markers, like looking for insulin resistance. We've talked a little bit about your female and male sex hormones, that those are going to be like those cycle-timed specific hormones. We also look at different things like liver markers, like your liver enzymes. So are we seeing signs that your liver is significantly stressed? We're looking at your vitamin D level, things like your B12 and folate, your cholesterol, your prolactin, which Amanda and I love talking about prolactin. You'll probably talk about that all day too, because that is one that's really not looked at enough, in our opinion, but that we see play a huge role in fertility. So if you want to touch on that, Amanda, I think that'd be great.
Absolutely. So prolactin is a hormone that really ideally should be elevated while breastfeeding and really not at any other time.
Mm-hmm.
And so when it is elevated for various reasons, whether it's elevated idiopathically, we don't exactly know why it is, or whether it's elevated because there is a small benign tumor pressing on the pituitary gland, either way, it can suppress or alter female and male hormones and prevent good female hormone balance.
And I'll just jump in here real quick to say, okay, why is it naturally elevated in breastfeeding and also a little bit in pregnancy too? Is because if you think prolactin, in that word you have lactation, so it's naturally a lactation hormone. So that is why it's elevated in those time periods. And when it's elevated, it's basically telling the rest of your body, hey, we don't need to be super fertile and ovulate right now. Our body is taking care of the baby that we just had. And so, sorry not to interrupt you there, but I just wanted to add that.
Absolutely. So we're going to jump into what we commonly find. Very often we find patterns that were technically normal, but not optimal. So some examples of this are the Hashimoto's, chronic low ferritin, insulin resistance without obesity or with obesity, postpartum thyroid shifts, those type of things, luteal phase defects, ovulation defects. And this helps us go in a direction to fix the symptoms and try to get to the underlying cause of whatever condition a woman is coming to us with. And I like to say we always find something.
Mm-hmm.
You're not coming to us with symptoms that are isolated. There's a reason for it. And our goal is to restore health and get to that reason. But it often does take a lot of digging, history, labs, and that sort of thing.
Absolutely. It's not always a straightforward, simple, easy path, but our bodies are so incredibly smart. They're miraculous. God made them the way that He made them, and they're not broken. If you're having these symptoms, if you're having these issues, it's because there's something that our bodies are telling us. They're depleted or they're inflamed or stressed or all of the above. And so investigating why and taking a deeper look as to what your body is saying, where it's struggling, where it needs help is, where we come in and what we're really passionate about and what we're made for in helping our patients feel better and be restored to how we should be.
And I know we're running a little bit short on time, so just going to say as kind of a blanket, after testing, we spend about an hour reviewing everything in detail, and then we'll recheck as frequently as we need to support healing and restoration. And so I think we can wrap up with who this is for.
Yeah. So, this is for pretty much anyone. Of course, we work with women a lot, but we also, work with men, especially in the context of fertility and whatnot. But just a few, if this applies to you, this would be helpful. So if you, have premenstrual symptoms that are debilitating or worsening or negatively impacting your daily life, if your cycles are irregular if, you're in the postpartum and you have symptoms that are not, normal and are significantly impacting your daily life. If you are perimenopausal and don't feel that you're getting the support and help that you need, these are things that you deserve care and treatment and attention to. And so our treatment plan, typically is very multifactorial as well. So we want to include, prioritizing all the foundational things from your nutrition and your sleep, but also, touching on stress and maybe supplements, lifestyle changes, medications that might be helpful, because all of those things are very important.
And so our goal is to help women understand their physiology and to restore the female body to what it was created to be. Because when you understand what your body is doing, you can work with it and not against it. And if this resonates with you, if you feel like this is something you're interested in, you can learn more about our women's health evaluations on our website.
Yep. And that is the Fiat Health website. And again, this has been Maddie and Amanda with Fiat Integrative Health. Thank you for listening. I know that we have had a great time, and hopefully you guys have learned something along the way.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.